This is Hearing Awareness Month. Audiologist Katie Koebel from HearingLife Canada joins us to shed some of the stigma around hearing loss, because for so many people, it's seen as a sign of aging. But people of any age can have hearing problems.
Yeah, that's true. So I think a lot of people think about if you have hearing loss, that means that you're getting older. And while it's definitely more common as we age to develop hearing loss, it can happen at any age. And that doesn't mean that we shouldn't be doing something about it. We've got a lot of great technology out there nowadays that can really help you to stay connected in your life.
Okay, including this little device down here. So this is like a charging, it's your hearing aids and the charging device for it. Because how often do these have to be charged?
So if you're wearing your hearing aids every day, they do need to be put into the charger at nighttime.
Okay.
So back, before these recent advancements, they actually had a tiny little button battery that would have to be changed out every few days. They were very hard to. Yeah, they were very hard to manipulate, and so a lot of our hearing aids today now have a charger. So you just pop them in there at nighttime, and then when you put them in the morning, they're ready to go. You wear them all day, and then at nighttime, you just put them back in the charger.
Okay, and these are 4D hearing aids, so what does that mean?
So these particular hearing aids have a 4D sensor. So what that means is there's an accelerometer inside of them. So it's detecting your movements and personalizing how it amplifies the sound based on those movements. So you're going to want to have a different sound based on if you're just kind of scanning a room or if you're engaged in a conversation with one person. So it detects whether you're kind of looking around to multiple people or if you're just really zoned in on one person.
Okay.
So it'll bring that sound that you're wanting to hear, that conversation you're wanting to hear, really to the foreground. So you're able to attend to that and be engaged in that conversation more.
And how does that work in a situation, say you're in a busy restaurant where there's lots of noises, but you're trying to talk to the people at the table? So that kind of narrows in on that, I guess, just where you're moving your head?
Yeah, so also on where you're moving your head. These also have artificial intelligence in them. So they've been trained with millions of different sound scenes. So really to support the brain's natural way of hearing, where we do need access to all sounds, but we want the sounds from the conversation to be brought to the foreground. So they're really smart technology. There's a lot in there to really make really great personalized decisions on what sounds to really bring to the foreground and what sounds to kind of leave in the background.
Okay. And these ones you can also connect to your phone, so you could listen to things on your phone like podcasts or music.
Right, yeah, so they have Bluetooth technology, so you can pair them with your cell phone. You can stream those calls, music, podcasts. You can also connect them to, you can get an adapter to connect to your television or radio or your home phone. So really gives you all of that access to sound right at your ears.
Okay, and very, very small.
Yeah, they are, yeah, they've come a long way for sure.
Now, is this like one of a kind of thing? I'm just going to turn them around to show here what they look like as well. Is this kind of like a one of a kind thing, or are most hearing aids going towards this model?
Yeah, so most hearing aids now are going towards the, a similar size, similar shape, rechargeability, very similar. But there still are options. So some people still prefer the ones that are the custom hearing aids that go in your ear. So those are still available. Sometimes if you have a more severe hearing loss, you need to get something that's maybe a little bit larger. But these ones are actually able to accommodate most hearing losses nowadays.
Okay. And do you need a doctor's referral to get your hearing tested?
No, you don't. So in Ontario, you can go and call any one of our clinics. You can either call our clinics, you can visit us online at hearinglife.ca. Our initial hearing assessments are actually complimentary, so there's no charge for them. You get a full hearing assessment on that day, and your hearing care professional will go through the results right then.
Okay.
So we do recommend, if you're an adult, to get a baseline hearing assessment. Whether you're noticing any trouble with your hearing or not, it's a good idea to kind of go get it checked out.
Okay. Good advice there on this Hearing Awareness Month. We'll get the links up on our website, chch.com/morninglive.